This is an I Am Listening exclusive podcast.
Throughout school systems, whether it is an issue of the education system or not, I think there are certain changes that need to be made, and there needs to be more recognition and a lot more teacher training. But I mean, only recently, I'd say in the past 5 years or so, I have become more proud of my ADHD and not as sort of embarrassed about it or shy to tell people I've got ADHD. And I'm definitely more proud about it now.
Welcome to Dr. Nicki Explains. I'm Dr. Nicki, a GP of 24 years experience, and this is my friend Sarah.
I'm a mum of 4 with no medical background.
We've decided to do a podcast to explain medical conditions, hopefully in an accessible way. We often have a guest speaker who has experience or expertise.
The podcast is not a substitute for seeing your GP. If you have medical symptoms that are troubling you, please see a doctor.
We've based the podcasts on NICE guidelines, which is the National Institute for Clinical Excellence.
The podcasts do contain graphic descriptions of medical conditions and may not be suitable for a younger audience or those of a sensitive nature.
Thank you for listening. Today, we're here with me, Dr. Nicki.
And me, Sarah.
And me, Hugh.
And Hugh, you very kindly agreed to come and talk to us today about ADHD.
Yes.
Now, before you launch in, can you explain to me, and I'm guessing some of the other listeners who might not be entirely clear, on what ADHD actually is?
It's always the way with medicine. You have these sort of letters and you've got no idea what it all stands for. And it's always a bit of a mouthful. And this one is Attention Deficit Hyperactivity Disorder. But in actual fact, what that means is there's a sort of bunch of symptoms. So it includes inattention, sort of not being able to focus, hyperactivity, which is a lot of extra movement that probably doesn't suit the setting the person is in, and impulsivity, which basically means hasty acts that occur in the moment without thought. So that's a sort of rough idea of the types of symptoms. And it's extremely common, one of the most common, I suppose you could call it a mental disorder affecting children, young adults and adults, because it tends to persist. I wondered, Hugh, how it presented in you.
So originally, I didn't really understand ADHD in the beginning, and I didn't know that I had it because I think initially I saw myself as the naughty child at school, and I think that's the case for a lot of people. They notice in themselves that they have a lot of energy, they find it very hard to concentrate, hard to sit still, and only really recently, I think in the past decade or so, people have begun to see signs of ADHD in people, and it has become a lot more diagnosed across the board.
So in you said you were a naughty child.
Yes.
And so how would you be disruptive, or what kind of things would you do to have that label?
And can I add a question to that?
Yeah.
Was this at primary school as well?
It was, yes. So it was for as long as I can remember. I think my two main things were my energy. I found it very hard to come down from levels of energy. And the other big thing was disruption in class. I always wanted to try and make people laugh and not necessarily be centre of attention, but sort of just, be the class clown and always make people, around me.
And you couldn't sit still.
Couldn't sit still. And I think
in your pants.
Yes, exactly. Yeah, all of those sorts of things.
Yeah.
Which is a real issue for teachers, and it's incredibly hard for them to control a whole class, let alone, another person who is constantly all over the place.
And so how are you labelled at this stage then?
So across every single class and every teacher I had, nobody understood that I had ADHD at that time, and I was naughty, and that was what I was. And I think people put me being naughty down to just not wanting to learn and actually having a desire not to put any effort into my studies. And it was only really at the end of my time at primary school that a specialist teacher came in who was a learning support specialist and recognised a lot of signs that she had seen in other children in primary schools and recommended for me to go and get tested for ADHD. And I mean, that was only when I was about 11 that came about, and I was recommended. But that was quite a shock to everybody because people didn't really know what ADHD was. And I think still today, it's a lot of people have a very unclear understanding of what it actually is.
And so you said you went to get tested. What did the testing involve?
So a lot of it was similar things to IQ tests. There was a lot of verbal reasoning, patterns and shapes, and trying to identify things like that. There was some testing to do with brain waves and brain functions, and sort of my brain waves. But just sort of loads of different tests and ways to understand how my brain operates in certain situations. And they also monitored how I behaved in those situations as well, and not necessarily what I was just putting down on piece of paper and the answers I was getting, but how I was functioning in those periods of time.
And so this was then, you were now at secondary school.
Yeah.
What did that look like then in the classroom? How did things change for you?
I think after I received diagnosis and received medication, it completely changed the dynamic I had in classrooms, and just completely changed my whole life. I think I saw education as this completely different thing. I began to understand why I needed to be in class and why I needed to pay attention. And the support around me after I was diagnosed was a lot more beneficial for me. And it wasn't as if they were sort of segregating me and trying to put a special treatment towards me, but there was the element that they were trying to help me and were trying to understand that, maybe there are things that I was finding difficult.
I mean, one of the things that we look at is how we can adapt to special needs like ADHD. So what sort of things in the classroom, and I know about medication, but we'll talk about that later, but what sort of environmental modifications were there? So what kind of things would you find you could adjust that would help you in the classroom?
Well, I mean, for me, I would always say that the classroom is a nightmare for me, because it's, people sitting in rows and having to pay attention. And it was always a situation for me where teachers would say, sit on your hands if you're finding it hard and if you're trying to move around loads. But I think allowing children to maybe potentially have more movement, and I understand that's difficult for your typical classroom because you've got other children who are trying to learn. But, giving sort of more support in that sense, and not necessarily reacting in a bad way if somebody is, maybe
fidgety or standing up
or climbing over the chair and stuff. And whilst that is difficult, I think also it doesn't need to be reacted in a poor way. It needs to sort of just maybe be understood.
Can you explain something which I've always wanted to know is when you are fidgeting and you have the desire to fidget, are you still listening? Are you still learning? But just that teacher doesn't think that you are learning.
For me, it's sort of, when I have tics and when I'm shaking my foot or tapping my legs and things like that, I think sometimes it does help with my overall brain process, and it sort of helps me take in the information and I'm being sort of told. And it's not as much, I'm not just listening, I'm actually hearing what they're saying. And I think, I would say that, being able to have the ability to, tap or to move around helps me hear what the teacher was saying and really take that in.
And it's sort of presumably not having too many distractions going on in the background, sort of noise outside the window or bright lights, or presumably you want to have as few distractions as possible to help you focus. Is that right? Or?
Yeah, I mean, that's always a difficult thing, because in a school environment, when you've got people moving outside the class and the bells ringing and whatever's going on, it's incredibly hard to narrow yourself down to just the one classroom and not sort of look outside. And so that's incredibly difficult. But I would say that when medication is brought into the picture and you're able to have the medication, it really does focus you on that one thing.
Seems like a good opportunity to find out a little bit more about the medication.
So medication has to be prescribed. In the UK, we have a system that the specialists initiate medication and the GP continues what has been prescribed by the specialist. So because the ADHD medication is what we call a stimulant medication, it's perverse, isn't it? Because I've always thought, if you stimulate someone that seems to be stimulated already naturally, that's never going to work in a million years. And yet it seems to work and really help with people's focus. But we have to make sure, because we're giving you a stimulant, that your pulse, that your blood pressure, your height, your weight, and that your heart is up to it. So before you start medication, you have to have a bit of an assessment to make sure that we've got some baseline measurements in place and that your heart's normal, effectively. But ultimately, the type of medication used is decided on by the specialist. And there's a kind of, if you look at the NICE guidelines, which is the National Institute for Clinical Excellence, there's a ladder of treatment that they use. And so, for example, they've all got long names, but methylphenidate is the first line. Then there's another one called lisdexamfetamine, and so on. There's more, we don't need to go through them all, but there's basically a ladder of treatment, and they are prescribed by specialists. The dose is upped and down by specialists, and GPs are responsible for making sure that your blood pressure stays the same or doesn't go up too much, that your pulse stays about the same, and that your height and weight stay about the same. And if they start to drop and we notice that people aren't sleeping, or that their weight is dropping, or their pulse is going up too high, or their blood pressure is going up too high on medication, then we would either drop the dose or give you what we call a holiday from the medication. It's some time off the medication to allow you to catch up and your body to adjust. Or we might switch the medication, but that would require going back to a specialist to do that.
Do you know, Hugh, actually how this medication works in your body?
In terms of its sort of scientific function, no. But having been diagnosed at a young age, it was sort of put into layman's terms for me, and it was you have the choice of a long-acting pill or a short-acting pill. And for me, I have had a range of different medication, and that has ranged from medication which lasts from 8 a.m. in the morning to 7 at night, which initially I found that incredibly hard to sleep after. And I've also had some very short-acting medication. And I think it's one of those things where you have to find the right one for you.
Hugh, how does the medication change you and make you feel?
So for me, the best way I could describe it is sort of horse with blinkers. I'd say that as soon as I take my medication, I'm very locked into whatever task I need to do throughout the day. So everything that I have been needing to do becomes very diarised, and I start thinking about what I need to do throughout the day and what I need to do by lunch and then onwards. Whereas had I not taken my medication, it's almost as if I have not a lack of desire, not a laziness, but I find it a bit more overwhelming, thinking, how am I going to do this? Or do I have time to do that and that? So it sort of fits pieces of the jigsaw together. Although I am told when I am on my medication, there is sort of a noticeable shift. I do become sort of more locked in, a bit more monotone throughout the day. I'm very, set on what I need to be doing, and maybe not as aware about people around me.
Not as flexible.
Yes, yeah. So less focused on other things and more focused on the particular things that I have set my mind to.
Do you think it changes you as a person?
I think slightly, and I think not in such a negative way that it's bad, but I think there is a noticeable shift, and unfortunately, I think that's what has to happen if you're needing to focus and needing to concentrate and wanting to take the medication. But there is a noticeable shift, and others around me have frequently said that is very noticeable for them.
So Hugh, do you take the medication every day?
No, is the answer, is the short answer. If I'm on holiday, I probably won't take the medication because it's sort of, it does focus me in, and it feels like something I have to take on a work day. And then, if there is a day that I am doing work or I've got particular tasks to do, if I had university work, if I had school work, I would definitely take it. And there were multiple days at school where I hadn't taken the medication, and it would really throw me off. I'd find it incredibly difficult to engage in tasks, and I think it would have been worse for me having not taken the medication and realising that I wasn't on the medication than if I didn't even know that I had to take medication. So it's definitely a great addition to my life, and on days that I need to take it for tasks, I will.
How long does it take for the medication to kick in?
Typically, I'll take it early in the morning. My medication is quite long lasting. So if I take it at 9 a.m., I probably start to feel the effects about 10:30, and that will work throughout the day. I will feel sort of a gradual decline towards the end of the day where, I don't have the same level of attentiveness as I did.
I was going to ask you, did you feel there was a sort of stigma to being diagnosed?
Definitely. And I'm not sure whether that was at the time I was diagnosed, but I still think that there is a stigma towards it. Yeah, I think people do associate children with ADHD as being naughty. And I've always felt that. And I think even before I was diagnosed with ADHD, because I was the naughty kid, it was picked up on. I think that's something that does really need to change. And throughout school systems, whether it is an issue of the education system or not, I think there are certain changes that need to be made, and there needs to be more recognition and a lot more teacher training. But I mean, only recently, I'd say in the past 5 years or so, I have become more proud of my ADHD and not as sort of embarrassed about it or shy to tell people I've got ADHD. And I'm definitely more proud about it now.
Are there any particular myths surrounding ADHD that you'd like addressed?
Yeah, I think still today that I hear a lot of funny theories that people have. And one that I hear quite a lot is people's reasoning for ADHD being down to poor parenting. And I mean, as silly as that sounds, people do still believe that there is some contrary, belief to that. And there are others as well, like, people thinking that, phone use is a part of it as well. But
Too much screen time.
But, this isn't something that you can catch or develop. It's something that's instilled into your brain, and, something that you can't necessarily change.
And in fact, it forms part of the diagnostic criteria that this is something that is from sort of early childhood, continues into adulthood, and persists in lots of different settings, not just school, but home. And that is actually one of the things they look at when they diagnose ADHD.
Nicki, are there any particular groups most affected by ADHD?
That's a really good question. Yes, in fact, if you look at the NICE guidelines for ADHD, it does give you a list, and it includes things like children born preterm, looked after children and young people diagnosed with conduct disorder, people with a close family member diagnosed with ADHD, people with epilepsy, people with neurodevelopmental disorders, people with a history of substance misuse, people known to the criminal justice system. I'm sure that's not you. People with an acquired brain injury. And so basically it is more likely in certain sections. I think the interesting one there may be that the people with a close family member diagnosed, because Hugh, I think you said before we started that your sister had been diagnosed with ADHD, but that she presented a little bit differently to you. And I just wondered how you thought, what you thought the difference was between boys and girls with ADHD from your experience.
For boys, typically, as we've spoken about, you have the aspect of being energetic, being hyperactive, and not really having an off switch. But for girls, I think there is a slightly different. There are some slightly different characteristics. Like for my sister, she found sort of social situations a bit more difficult, and there was a sense of anxiety on her behalf, whereas she didn't have the same characteristics that I did, and she didn't have the same energy or the levels of hyperactivity. So I think it's, as underdiagnosed as it is in boys, it's even less so in girls. It definitely presents itself in a lot different way.
Have you found that diet has any effect on your ADHD?
Having a balanced diet really sort of is the best way forward, because when I eat sort of high amounts of sugar or caffeine, I can definitely see differences, and especially on my medication as well. When I drink a lot of coffee, having taken my pills, I can really sort of see the energy level spike, and I can definitely say that other people around me recognise that as well.
Did you have to inform the DVLA? Was your driving ever affected? Because I know it's something that the DVLA ask for if it does affect your driving.
Yeah, so when going through the process of trying to get my licence, I did let them know, and there's a lot of information on the medication that says don't take when driving, because it will affect the way you drive.
Does it?
And yes, yeah, no, it does. I've frequently, I've never taken my medication whilst driving, but I can imagine that it probably would force you to have less sort of attention to others around you and have more focus sort of on the road in front of you. So, maybe I think it could skew your peripheral vision and,
So you're better at driving off your medication?
Definitely, yes, yeah.
That's interesting.
Yeah, and also sport as well, interestingly. I'll never take my medication when I play sport, because that that too has a big impact. I think like my hand-eye coordination is completely ruined when I take my medication. Yeah. So I think, whilst medication is great, there are instances where it's not always the right answer, and it's important to sort of just, use your own skills, initiative in most situations.
And I just wondered about parents and what support is out there for parents, because it's bewildering as well, isn't it? And it's bewildering as a patient to have this condition, but as a mum or a dad, and you've got, within your family, your son and your daughter are both affected. Did your parents have any support or what?
Yeah, there was some really good support. So after I was diagnosed, the practice I went to gave us a lot of opportunities to go to outreach, services and organisations, and the best groups were the parent-led ones, when it was 5 or 6 parents who just met for coffee in town during the week or weekend and talked about their children and their experiences.
Are there any famous people who sort of typically have ADHD?
Yeah, there are quite a few. Off the top of my head, I can't fully remember, but one of the people that I seriously look up to is a man called Loyal Kana, who is a rapper from London who talks a lot in his songs about ADHD. And he was one of the reasons why I sort of felt more comfortable to talk about it after beginning to listen to him. And I've listened to multiple podcasts with him and how he talks about how he turned it into a bit of a superpower and he found ways to combat it. And very recently, he set up a cooking school for teenagers with ADHD in Hackney, which unfortunately I was too old to go to. But I know that really, really helped people of that age.
Is it something that you'd like to do going forward, to be an influencer?
Yeah, definitely. I think I've met a lot of people who I have had a suspicion could potentially have it. And obviously it's quite a difficult situation to approach, because again, with the stigma, people do get a bit, defensive and say, well, I don't have it. I'm, perfectly normal. And that's always the phrase, that people say normal. And obviously, the term neurotypical or neurodiverse is something you want to stray more towards. But I would definitely like to help people who potentially have it and help them get through it, because there are definitely things in my life which I would like to have changed. And in hindsight, obviously I can't, but if I could help somebody else, I definitely will.
What would you like to change?
I think at the earlier age support. So obviously up until I was 11, I didn't have any real support, and for good or for bad, that was the way it was. And if I could help somebody of a younger age to develop, and
so really a message for parents.
And a message for parents
that there is support out there, and that you shouldn't worry about getting your child diagnosed, because it's actually a helpful thing rather than
absolutely.
Than a thing.
And it isn't something that they've done wrong.
No, exactly.
It's not a bad thing. It's something that can be harnessed as a great thing.
I was just going to, that leads me on to what I was going to ask you, which was the rapper described it as a superpower.
Yeah.
Is there something about your ADHD which you feel is a superpower? And if so, what does it sort of help you do?
I'm not sure. I think I'd like to think that I'm all right at making people laugh. Like I do enjoy sort of finding the funny in situations and actually bringing some joy out of situations which might not necessarily be that joyful. And I've met loads of people with ADHD who have those weird abilities to do things and just random quirks which maybe sort of the neurotypical person doesn't have.
And I think you've discussed on other occasions about your sportiness and your energy levels maybe helping you with that. Do you think?
Definitely, yeah. I think a bit like a cockapoo. I don't really know when to stop. Like just very high energy levels, and that's something I really like to harness. And I love sport, and that's sort of my biggest passion in life. And whatever sport is available, I like to give it a go and play it. And I would put that down to ADHD for sure.
I think there is a bit of a problem at the moment, isn't there, with the referral times and also with getting medication. It's been a real frustration in primary care. I think the wait time for specialist referral is between 1 and 3 years, which, when you're a small child going through the education process, that's a long time in the life of your school life, isn't it? So I know people have been using Right to Choose, which people have been coming in, and that really is something whereby we, as GPs, we can gather together the information we need. And then there's a website called Right to Choose, and we can use, basically it's a way of looking at all possible options, NHS and independent and out of area options, to find where the shortest wait time is. Even using that, it's still, unfortunately, mostly taking months and months to get a specialist diagnosis, which is really frustrating. The other problem we've had is the lack of availability of these medications. Did you have a problem getting yours?
There was a period just before Christmas where there was a shortage of my particular medication, and I found that very difficult. Yeah. It was really hard. I was having to ration medication, and I was going through my first semester of my final year at university, and it's fair to say that wasn't that fun.
I just wondered obviously people are going to be listening here who are either struggling with ADHD or a parent with a child and they think they might have ADHD. And I wonder what your lessons are or what you'd like to tell them. Say you were, I don't know, you wouldn't be a 4-year-old listening to this, but you might be an 11-year-old listening to this podcast and just feeling a bit low maybe and not really understanding what's going on and what to do. And I really like your idea of it being a superpower. I just wondered if there's something positive you can say to people listening.
I think multiple things, but the first is don't be afraid of it. And if you are having qualms about getting diagnosed and we're not sure whether to do it, just do. Even if you're not sure and you want to potentially, ask the question, do I have it? There is nothing wrong. There is nothing wrong with that, And if you are diagnosed with it, then that's amazing because it will give you so many answers to questions that you might have. And also, don't be put off by what people say. There's a lot of ignorance surrounding ADHD and many other things, many other mental issues. So really, don't be put off by what people say because it's your life and whatever works for you.
Well, it sounds like the medication's transformed your life.
Yeah, absolutely. Yeah. And even just the diagnosis and understanding reasons for why I'm doing particular things that beforehand I was beating myself up about, going, why can't I just be normal? Why can't I just do this? When actually at the end of the day, there was a reason for that.
Are there any charities or support groups, that might help?
Well, Hugh, you've already mentioned that your parents found local support groups very, very helpful.
Yeah.
There is a national charity, ADHD UK, which would be a good place to start.
And we found a good website called UKAAN or UK Adult ADHD Network, which is been put up it was created by a small group of adults who've come together for better recognition. But basically it does have quite a lot of good resources, how to live with it, what are the adaptations you can do to help. So that looks quite helpful, although I've got no personal experience of it myself using that website.
So it looks like there's quite a lot of support out there, and definitely if you're concerned at all, start by going to the GP.
Yes.
Look at these websites.
Yes.
And don't be afraid.
Yes. And we're sorry the wait time for referral is so long, but we'll do the best we can to get you where you need as fast as we can. But Hugh, thanks so much for your time today and for sharing your, as they would say, lived experience, which is very true. We really appreciate your time.
Yeah, it's been totally fascinating.
Yeah.
We hope you've enjoyed this month's podcast. Don't forget that if this has made you aware of troubling medical symptoms, you may need to see your GP.
This has been an I Am Listening exclusive podcast. For more information, head over to our website, im-listening.co.uk.